Hey guys, well, we spoke with several nurses here in the Valley who spent time working in hospitals. They echo the same sentiment. Burnout is driving more healthcare workers into the $18 billion industry of med spas and cosmetic nursing.
What areas are you wanting to get treated today?
Brittany Allred owns the Needle Fix in Peoria. She now specializes in Botox and filler injectables after working full-time as an emergency room nurse for more than a decade.
It's just a whole different kind of nursing. It's more of a friendship, relationship building.
She says burnout and aggression from patients is a big issue in hospitals. Healthcare professionals are 5 times more likely to experience workplace violence than workers in other fields, according to government data. The pressure of working in that environment pushed her into aesthetic nursing.
But definitely switching out of the hospital setting made a huge impact on my mental health, I would say. I feel like before doing this, I would come home and not have the patience or sympathy that my kids wanted of me because I gave, grown adults that and they treated me poorly.
In Surprise, Tanya Carosio followed a similar path. The doctor of nursing practice owns Bena Health after spending 30 years working in hospitals. She's also a nursing professor at ASU, tracking this new trend firsthand from students.
There are quite a few that say they want to be in some kind of an outpatient setting. Not many are wanting to be at the hospital setting. Not many are really wanting to be in that bedside role. Which is concerning.
This comes as our state faces a critical nursing shortage, straining hospitals, especially in rural areas. The National Center for Health Workforce Analysis predicts our state will have nearly 30,000 fewer registered nurses that are needed in the state by next year.
You start to see that burnout. They are going to look for something that's going to be like, I need balance. I need something that's going to make me feel good.
Meanwhile, universities like NAU have developed fast-track nursing programs that allow students to complete their nursing degree in less than 18 months. Health experts say they hope this helps with the nursing shortage, but people like Carosio say there needs to be more of an overall effort to address burnout among healthcare workers in hospitals across our state. Reporting in the newsroom, I'm Lockhart for Arizona's Family.